More than 1,600 patients are fighting the new coronavirus here in the United States. At least 42 have been infected right here in Florida. And late last night, we learned a man here in Duval County and another in Clay County are also infected. One thing doctors and health officials say is vital in stopping the spread as we look at this world map and the United States map is for you to do your part. Stay home if you're not feeling well. Dr. James St. George is the president of Duval Medical Society and is joining us here this morning. Thanks for being here. I appreciate it. I think we're getting used to, you know, when we met, we just do the elbow, and I think that's part of this also. I mean, it seems when you. I think that what's happening is that people are hearing about infections and then they're hearing about deaths, since that's usually part of the same sentence, and it's frightening people, and we don't want to do that. So the first thing I want to talk to you about, if we can, is that this isn't killing everyone. It's actually a small percentage of people, because most people, if they're infected, only get a mild case of this.
That's absolutely correct. I mean, there is a little bit of a hysteria. I think Channel 4 said it best with prepare, don't panic. This is a version of an infectious disease similar to the flu. Most people are asymptomatic or only have mild symptoms. Many people don't even know they're sick. It is not an issue that we have to be overly concerned about. We need to be cautious. It is a new virus. We don't know a lot about it. We're still working on those issues, but you should handle it like you would be concerned about the seasonal flu.
So that said, there are some who are considered at higher risk of getting really, really sick. We've heard 60 or older. 60 isn't elderly in
I'm
my
61.
Mind.
Come on
right.
now.
Well, no, and that's why I think that, you know, there are a lot of very healthy 60-year-olds.
Right.
So what is it about that kind of underlying condition? What are those conditions that could really be a real complication if they're infected?
Again, the analogy is the flu. So the people who are susceptible to serious illness in a regular yearly flu we get every year, we deal with every year, is the same population. Elderly individuals, the older we get, we lose our immunity. So if you have additional illnesses, heart disease, diabetes, severe asthma, lung disease such as emphysema, any systemic disease that could potentially affect your overall health, well, this is one more thing that could maybe put you over the edge a little bit. So advanced age is a risk.
And so what is your message to people in that field, 60 or older, that maybe have an underlying condition? You know,
the things, just like any other common sense issue with the flu, it's the same things we do for every kind of illness. It's if you're sick, stay at home. If you're sick, don't go visit, you know, your grandparents at the nursing home. Maybe stay a little distance away from your elderly parents. Wash your hands. Avoid touching, you know, the elbow bump. You know, this is spread by respiratory, so if you cough, don't cough into your hand, cough into a tissue or the elbow. That way you avoid spreading the disease. And wipe down surfaces, keyboards, phones, such as that. These are the same things you would do for any illness, the flu, or any other type of illness. There's nothing special about corona. It's the same precautions.
As we have seen around the world, particularly in China and Italy as an example, oftentimes it's before you're symptomatic, which is when you're most contagious. That said, what are the symptoms that people at home need to know? This is when you decide, don't send the kids to school. This is when you decide to stay home from work. Because we're all sniffling a little right now. I mean, the allergies are killing me. So is that a reason to stay home? Probably not.
Well, you know, it's thought that maybe some people can spread when they're not symptomatic, but most of the spread of this disease occurs when people are feeling symptoms.
Okay.
So those symptoms are flu-like symptoms, all right? You just feel drowsy and dragging. Maybe your hair hurts a little bit. You feel tired. You may have some shortness of breath. You may cough, maybe a sore throat. But the general big ones are fever, cough, maybe some shortness of breath.
Doctor, thank you for being here.
My pleasure.
It's so important to educate our, our viewers so that no one panics, because that is the bottom line here, not to panic. Rich?